Good morning, everyone. So, I welcome you all to this FB Live by SRJ CBCC Cancer Hospital Indore. I hope you all are safe and sound. So, as we know, today our topic of discussion is your answer for anemia. And for that, we have a renowned doctor with us, Dr. Mayur Mundhe. So, let me give a warm welcome to Dr. Mayur. Welcome, Dr. Mayur.
Thank you. Thank you.
सो ऑडियंस थोड़ा सा मैं आपको डॉक्टर मयूर के बारे में बता देना चाहूँगी. सो डॉक्टर मयूर मुंडे इज़ अ क्लिनिकल हेमेटोलॉजिस्ट एंड बोन मैरो ट्रांसप्लांट फिजिशियन practicing at SRJ CBCC Cancer Hospital Indore. He has more than 5+ years of experience in the field. His area of specialities are hemato-oncology, bone marrow transplant, and benign hematological disorders, which includes anemia, coagulation, and bleeding disorders. So, we are glad to have you, doctor.
Thank you.
So, sir, any opening welcoming remarks for our viewers?
Just today's topic is actually quite common thing which we see in day-to-day practice. Anemia is not only a single problem, but it is associated with the multiple problems. So
Yes.
the awareness regarding the anemia is very important because it is highly treatable disease, and early detection and the treatment can have the very good health results of this disease. So we should be aware of the anemia.
यस. एंड मैं बिल्कुल उम्मीद करती हूँ कि आज के सेशन से बहुत ज़्यादा लोगों को अवेयरनेस होगा, उनको पता चलेगा अनीमिया के बारे में बिकॉज़ हम लोगों ने नाम बहुत सुना होता है, पर
Yeah.
एक्चुअली क्या है, वो काफ़ी सारे लोगों को नहीं पता होता है. मुझे भी बहुत ज़्यादा नहीं पता है.
Yeah. Okay.
या. सो कैन वी स्टार्ट विद द क्वेश्चंस, डॉक्टर?
Sure. Sure. Yeah.
Okay. So my first question is, let's start with the basic. What is anemia?
Yeah. So in day-to-day practice, we have every one of us has heard this word many a times that we are having anemia. It can be of variable degree. So anemia word basic origin is from the Greek word, which means the lack of blood. Literal meaning of the anemia. But in the medical terminology, it is defined as the decrease in the oxygen carrying capacity of the blood. And it is because of the decrease in the hemoglobin concentration when we do the blood test, and there may be the decrease in the red blood cell count also. So basically, this is anemia, which is decrease in the hemoglobin level of the patient.
Hmm. Okay. So next question, doctor, is who is more likely to suffer from anemia?
Yeah. As such, no age group or no sex is barred from the anemia. Anyone can develop the anemia. But to be precise, the school-going, growing children, they are more prone to develop anemia. Then other population is the young females who are with the active reproductive cycles because they have the menstrual blood loss, and particularly pregnant females, because the body's physiology changes in such a way that there is hemodilution and that lead to the anemia. So these three age groups are quite vulnerable for the development of the anemia. And besides that, the patients who are having the chronic disorders, like those
Mhm.
who are suffering from the kidney diseases, tuberculosis, or the rheumatoid arthritis, such a class of patient is also very much vulnerable for the development of anemia. And many of the cancers, along with the cancers, the patient usually have the anemias.
Okay. So, doctor, how does anemia really, I mean, if affect the body? So, what are the changes that we can see?
Yeah. So actually, this is very important question because anemia is so common, and we don't know exactly how can it affect our body. So there are various grades of anemia. It can be mild, it can be moderate, it can be severe. That depends on the level of hemoglobin at the time of diagnosis. But when it is mild to moderate, the patient's daily activities, they are not hampered. That's why the patient is not aware. But when it goes to severe form, even the daily activities are hampered. That even after walking for few steps, patient starts having breathlessness, breathing difficulty. There is an increase in the heart rate of the patient, and there is increased breathing efforts of the patient. Patient looks, his skin looks pale, mucous membrane and eyes, they start looking pale. And in the severe form, it can affect all the organs of the body. Like a patient can have the cardiac failure, the lung function tests are affected. So depending on the severity, it can affect any organ of the body.
Okay, doctor. Okay. So, doctor, what are the common signs and symptoms that can indicate that the person has anemia?
Yeah, just we have discussed that depending on the grade of the anemia, mild, moderate, severe, we see. So first
Mhm.
thing, we look in the day-to-day activity that some patients' complexion is changed. The person's complexion is changed. He started looking pale. He is complaining of weakness, that I am not feeling well. And even in the day-to-day activity, he's not that much fit, or that much what we can say, with the energy level of the person is decreased. So these are the some early symptoms of the anemia which person can get to know himself. And when the patient comes to our OPD, we examine him for the presence of the pallor all over the body, how is tongue looking, how are his eyes looking. So these are all the symptoms which can the patient present. And in the severe case, patient is completely bedridden. He is not having any energy. He is having the palpitation. That means he can feel his own pulses, and he is having breathing. He has to do some breathing efforts even to walk. So these are the common signs and symptoms of the anemia. And depending on, in some cases of anemia, the patient can have jaundice also. That is the yellowish discoloration of his eyes, and his urine becomes the dark yellow in color. So, and sometimes because of the increase in the size of the liver and the spleen, patient having the abdominal problems also, that he is having abdominal pain, nausea and vomiting. So all these symptoms can be there. So collectively we have to look for these all symptoms.
Okay, okay, doctor. So, doctor, as you said, there are many symptoms. So, if symptoms are positive, what should be the next step? So, किस स्पेशलिस्ट के पास आपको जाना चाहिए?
Yeah. So hematology is the clinical science or the medical science which deals with the all the blood disorders. So whether it is anemia, whether it is the platelet count related diseases, or whether it is blood cancer. So one should definitely visit the hematologist to get to know the whether person is having anemia, what is the grade of anemia, and most important, what is the cause of anemia, because treatment of anemia depends on that. So one should visit the hematologist for the definitive management of the anemia.
Mhm. Okay. So, doctor, next question is what tests are used to manage anemia and what do they actually mean?
Yeah. So for the diagnosis of anemia, it is just not a laboratory thing. We have to start looking at the patient first. So we have to listen for the patient's complaint. What we have discussed till now, the patient has those variable complaints. Then we look for his overall general physical appearance, his color of his eyes, tongue, his overall skin color, and then
Mhm.
abdominal examination we do in our OPD. After that, we go for the first line of test, in which it includes the complete blood count, CBC. Many of us are knowing very well about the CBC, which gives us idea about the hemoglobin level, red blood cell count, and other things in the blood CBC report, like the red blood cell indices, which are very much important for the accurate diagnosis. Then we go for the peripheral blood smear examination, which gives us idea about the red cell morphology, how the cells are, whether they are smaller in size, larger in size. Depending on that, we can have the idea about what is the cause of the anemia. Any atypical cells are seen in the blood, peripheral blood, which can give the clue that towards the patient can have any kind of malignancy or the cancer like thing. And then we do the usually reticulocyte count. So these are the first line tests. Depending on the results of this test, then we go for the specialized test, that if we are suspecting if the patient is having nutritional deficiency like iron or vitamin B12, then we have to estimate the levels of these nutrients. And if we are suspecting that there is some problem, that the atypical cells are being seen, or there are many things which we have to look in the peripheral blood smear. Depending on that, few patients may need the bone marrow examination also to ascertain the diagnosis of the anemia.
Mhm. Okay, okay, doctor. So, doctor, is there any general complication that is associated with anemia?
Yeah, in the complications which we have seen, the patient themselves feel like lack of energy, weakness, easy fatigability, breathlessness, and not able to do his even daily routine activity. These are the complications. But anemia, if it persists for a longer time, and if it is of moderate to severe grade, then as we have discussed, that it can affect one's heart, kidney, even the central nervous system. So these are the long-term complications of the severe anemia.
Okay, okay, doctor. So, doctor, I'm done with my set of questions. Our viewers have some questions. So, अभी हम लोग थोड़ा उस पे बात करते हैं.
Sure, sure.
So, first question is from Hiral Shah. She is asking, is anemia hereditary?
Yes. As we, this is actually very important thing because anemia, as we are discussing, that it is having the multifactorial origin. So it can be most commonly like nutritional or something, but it has hereditary component also. And the most common diseases which we all are aware of, it's like a thalassemia, sickle cell anemia, which usually we call it as a hemoglobin disorders or the hemoglobinopathies. Besides these disorders, there are again certain bone marrow failure syndromes, which we call them as inherited bone marrow failure syndrome, in which also anemia can be seen as a hereditary problem.
Okay,
So
okay,
definitely
okay.
anemia, it can be hereditary.
Yes. Okay. Next question is from Fagun Shukla. He's asking, how is iron deficiency anemia diagnosed?
Yeah, this is important question because if we can say out of 100%, 60 of them can have the iron deficiency related anemia. So it is very important to diagnose this type of anemia at the earliest stage. The patient comes with the symptoms and the suspicion of the anemia to us. Then we do routine CBC, that is the complete blood count, in which we can see the red blood cells, the hemoglobin is low, the red blood cell indices are showing something, that the one of the component is mean corpuscular volume, that is MCV. It is
Mhm.
reduced. It is usually less than 70 in the CBC count. Then we go for the reticulocyte count, which shows us the means earlier form of the RBCs that also decrease in the lab test reports. And we see the peripheral blood smear, in which the RBCs of smaller size than the usual. We call it as the microcytic, and they are having the less hemoglobin. That's why they are the hypochromic. So it's hypochromic and microcytic picture on the peripheral blood smear. After going to this, then we go for the special test like the estimation of the iron levels in the blood. So we do the serum iron level, we do the ferritin level, we do the total iron binding capacity and the transferrin saturation. So this set of tests is required for the diagnosis of the iron deficiency in a person.
Okay, okay, doctor. So, next question is from Pragya Khanna. She is asking, what are the food items that may increase or decrease the iron absorption?
Yeah, so this is again a good question because most of the things, especially in the children, they are associated with the nutritional deficiency because of the
Mhm.
food habits of the children. Even in the adults, also, many of us has the particular food craving, that they are not taking the balanced diet. So the items which can increase the iron absorption, they are like any citrus fruits like lemon or the oranges. When we are having this in our food, then they helps in increasing the iron absorption. And there are certain food items, they can decrease the iron absorption, like the soya bean or the concomitant intake of the milk also, it can also decrease the iron absorption. So it is very important to have the balanced diet in our day-to-day practice to have the adequate iron stores of the body.
Okay, okay, doctor. Next question is from Mehul Patel, and she is asking, how long does it take to treat iron deficiency anemia?
Yeah, this is again very important thing to understand those who have the iron deficiency, because usually body stores deplete over the time. They are depleting slowly because the patient is either not having sufficient diet which is rich in the iron, or if there are some problems in the body itself, that the body is not able to absorb the adequate amount of iron. So there are the various stages of iron deficiency. We'll not go into detail of that, but it usually requires up to 3 to 4 months for the complete treatment of the iron deficiency. When we start the iron supplement to the patient immediately, within few weeks, he starts feeling better. The energy level is restored. He is able to do his day-to-day activity. But one should not stop the treatment at this stage, because it takes some time body's depleted iron stores to come to normal. So usually we continue the treatment for 3 to 4 months with the frequent monitoring of the CBC, how the hemoglobin is responding, and how the iron stores are being replenished. So once the iron stores are normal, then we are gradually taking the treatment off and
Okay.
making the person to have the normal diet.
Mm-hmm. Okay, doctor. Next question is from Shimona. Uh, she is asking what she can do to control her anemia. She is
Yeah.
anemic, I guess.
Yeah. So if you are having anemia, so first and most important thing is to know the cause. What cause you are having the anemia? If it is the nutritional deficiency like iron or vitamin B12, you should include the diet which is rich in these substances, that into day-to-day practice. And some of the patient, they also require the supplements from the outside in form of the oral tablets of the iron or B12. And many of the patient, they require the even injectable supplements depending on the severity of the deficiency or tolerability of the oral preparations, like if they are not tolerating the oral tablets. And there are another causes also, like if you have the bleeding from any side, if you have excessive menstrual bleeding, we have to look for the problem from there. If you have the blood loss during in the stools or the urine, then uh, we have to go for the cause behind this, and then you can control. So you have to look for all these things, whether you are taking adequate treatment, whether you are having adequate diet, and whether you are having any blood loss from your body. So that we have to look for and we have to be careful for.
Mhm. Okay, okay, doctor. Next question is from James Bose. He is asking, what are the main causes of anemia?
Yeah. So in India, the most common cause of anemia is the iron deficiency, especially in the females, those who are the young females or the pregnant females, and even in the old age, because they have some bleeding disorders. So main cause of anemia is the nutritional deficiency, and that too iron deficiency. And many of the vegetarian patients who are exclusively vegetarian, usually they tend to develop the vitamin B12 deficiency. So this is again a second important cause. Then other causes are if there is the blood loss, as we have discussed, whether it is from the gastrointestinal bleeding, if they have some ulcers, or the patients who have the gastrointestinal cancers, they tend to lose the blood in the stool. Then any sort of bleeding, like if gum bleeding, nose bleeding, if it is significant, it can cause the anemia due to blood loss. Then other causes, that the body is forming the red cells at adequate rate, but they are being destroyed. So we call it as the hemolytic anemia, which is seen in some case like the autoimmune hemolytic anemia, that body's immune system is not functioning proper, and
Mhm.
that immune system is destructing the red blood cell. In this case, hemolytic anemia can be seen. Then there are some hereditary causes like thalassemia, sickle cell anemia, where we can see the anemia as the hereditary thing, and some bone marrow failure syndromes. And definitely one of the causes is aplastic anemia, which is either hereditary or which is either acquired, in which all the three blood cell lines are decreased. So it is also one of the important cause to look for.
Okay, okay, doctor. So next question is from Akhil Dave. He is asking that can anemia cause death? So is can the condition be more serious and it can lead to death?
Yes, because actually it is not a really normal scenario now. People are very much aware about their own health system and everything. So early year diagnosis is the key. But in some cases, like the severe aplastic anemia, where the bone marrow is not functional properly, and body is not able to make any blood cells, because the stem cells, they are very less in number in the bone marrow. So in such a cases, anemia can be fatal. Yes, where the hemoglobin is consistently going down, patients other cell counts are also consistently going down, the patient, then in such a cases, infection is one of the most cause rather than the anemia itself. But yes, in some severe diseases, anemia can be fatal.
Okay. So I guess we are done with the viewers' questions too. So thank you so much, doctor. इतना बहुत ही एक अच्छा, insightful and interesting session आपने deliver किया. So any concluding remarks for our viewers?
Yeah, so as we, in the I have said earlier also, the anemia is really very much common thing which we encounter in day-to-day practice, and not only hematology but all sort of medical faculties, they are dealing with this problem. But what I want to advise as a clinical hematologist, that each anemia has a different perspective. So it is really important to know the cause, because just taking over the counter medicine for the anemia is not sufficient, and in long term it can have all the complications. So, what we have discussed today, it can lead to the heart problem, kidney problem. So whenever you are having a suspicion about the anemia, do visit your clinical hematologist, get yourself evaluated, get the proper advice regarding your diet. And it's more important in case of the school going children, because anemia and iron deficiency can affect their studies also. It can affect concentration power, it can affect their body development, because they are having the growth spurts, they require the iron, they require the normal hemoglobin. So for children, it is very important to get to know the cause and to treat accordingly. And in case of the hereditary anemias, the genetic counseling is also very much important thing which we should do in the interest of the society, because having a child with a thalassemia major is a great burden to the parents also, because the child is transfusion dependent. He has to undergo a lot of problems during his treatment, the
Mhm.
problems to the disease itself related to blood transfusion. So
Mhm.
genetic counseling nowadays, it is really recommended for those who are having the family history of any such a diseases. So these
Mhm.
things are really important. So anemia we cannot take with a it is not a walk or the cake. So we have to be really careful and we are really watchful while we are being diagnosed with the anemia and while we are on the treatment for the anemia.
Mhm. Yes, yes. थैंक यू डॉक्टर।
Yeah,
सो व्यूअर्स, जैसा कि डॉक्टर ने बताया अभी कि अगर आपको भी लगता है कि जितने सिम्पटम्स आज हमने डिस्कस किए अगर उनमें से कोई एक भी पॉजिटिव है तो डॉक्टर को विजिट करना ज़्यादा अच्छा है, कंसल्ट करना ज़्यादा अच्छा है, ज़्यादा दिन के आप डाउट में रहें, बिकॉज़ कंसल्ट करेंगे, एडवाइस लेंगे तो जल्दी उस चीज़ से ऊपर आ पाएँगे, बेहतर हो पाएँगे। और इसे किसी भी कंसल्टेशन के लिए अगर आपको भी लगता है कि सिम्पटम्स पॉजिटिव हैं, आप बिल्कुल डॉक्टर मयूर मुंधे से मिल सकते हैं जाकर एसआरजे सीबीसीसी कैंसर हॉस्पिटल इंदौर में। सो थैंक यू सो मच डॉक्टर, थैंक यू सो
thank you,
मच, सो मच
thank
फॉर
you.
जॉइनिंग। थैंक
Yeah,
यू।
thank you.